Hello, I am Urologist Ömür Erdem Akkaya. Today I will give you a short video presentation about MENT, namely methyl testosterone. It was discovered in 1963, and after it was discovered, there was no study on MENT for a long time. Even in Anabolic 11 the author reproaches about it. He says, why millions of dollars were spent and no publications were made on this substance even though it was produced in the golden age. Bayern Company started to conduct studies on MENT in the early 2000s, 37 years later. It has published many publications on whether we can use MENT in testosterone replacement therapy in men, and as a male birth control method. However, since the publications were made in a limited number and on limited patients, it could not be approved by FDA. That's why there is no legal preparation about MENT in the world. In other words, it is produced in underground centers, but MENT has no legal preparations. Another feature that distinguishes MENT from other anabolics is that it is in the nandrolone group and its anabolic index is seriously high. It has a significantly higher anabolic effect than tirenbolone and decabolin. It is a substance with an androgenic index of 650 and an anabolic index of around 2300. When we look at its chemical reactions, it does not turn directly into estrogen in the body, but turns into estrogen metabolites. However, it still has progestogenic effects on the body. What is it doing? Studies in rabbits have shown that it enlarges the uterus in female rabbits. So it has a serious progestogenic effect. Both estrogenic and progestogenic effects carry the risk of gynecomastia. Although gynecomastia did not occur in men at low doses in the studies, such side effects can be observed among anabolic users for these reasons. Apart from that, it shows a strong androgenic and anabolic effect because it does not bind to sex hormone binding globin or binds at a very low rate, and does not undergo alpha reductase reaction. Because it does not turn to dihydronandrolone like nandrolone, with the effect of 5-alpha reductase enzyme. And so, it effectively stays in its own form. When we look at the known side effects, it has the side effects of classical anabolic agents. It does not cause hepatotoxicity, that is, it has no known toxicity to the liver. Other than that, changing the cholesterol profile, causing hyperviscosity, and increasing the risk of thrombus are among the known side effects. In general, this is all about MENT. Thanks for listening, best regards.